Hi, I'm Dr. Peter Petropoulos with Potomac Medical Aesthetics. I'm going to talk about Coolsculpting today. Coolsculpting is one of my favorite procedures because it works. It is a great non-surgical procedure for permanent fat reduction. It's been around since the late 1990s, but was FDA approved in 2009. So it's great for patients who have areas of fat that are stubborn, that just don't go away with any diet or exercise. It takes advantage of the fact that fat cells die at a temperature of -11 Celsius, and we can leave the rest of the tissue healthy and intact. So anywhere that we've got pinchable fat, we can treat. And it's the #1 non-surgical fat reduction technology in the United States. So when fat cells are exposed to the right temperature of cold, they will die, and the results are permanent. They have been doing this since the late 90s, and there is no evidence that the fat cells actually come back. So it's a permanent procedure. So the most popular areas for Coolsculpting to be done are the chin, the arms, the abs, the love handles, bra fat, inner thighs, outer thighs, upper thigh. So wherever we can grab fat, we can treat it. How does it work? Well, we put a sticky pad on you, and then wherever we're treating, we'll put a sticky pad on, and we'll take this applicator, turn on the suction, and typically each spot will be between 35 to 45 minutes. We, on average, will get a 20 to 25% reduction of fat cells on that top layer of fat. That's permanent. So once we put it on, we turn it on, and it goes numb. After we're done, we then massage it with the Z-Wave, which is an ultrasound jackhammer that really works well to give a better result, and it's much more comfortable. Treatment is very mild. The first 5 minutes of the treatment, again, you get very cold, little prickly sensation, and then it goes numb. So what happens afterwards? Well, you're numb at the treatment site for about 2 to 4 weeks. You're sore and somewhat swollen for the first couple of days after the procedure. So it's not like a gym soreness where every muscle hurts with every movement. It's when you pinch it or when you move, it feels a little bit sore, like a bad bruise. But most people don't take even Tylenol or Motrin. The numbness lasts for about 2 weeks, the soreness for about 2 to 3 days, and the swelling for a couple of days also. So the consultation is pretty critical. So we want to see, are you a good candidate? Things that may not make a great candidate would be excessive loose skin. Is there too much fat tissue? Is the fat tissue inside the abdominal cavity where that treatment is not going to work? And for most patients, it's very cost effective, but the consultation also dictates how many areas we're treating and how expensive it's going to be for the procedure and if it's the right procedure for the patient. So who's not going to get Coolsculpting? Patients who don't get Coolsculpting are those who are pregnant or breastfeeding, and there are 4 rare conditions associated with when we're not going to do Coolsculpting. One of them is cryoglobulinemia, the second is paroxysmal hemoglobinuria, cold-induced anaphylaxis, or cold agglutinin disease. Those are rare conditions, but if you have those, we're not going to do Coolsculpting. Common questions associated with Coolsculpting. Do I lose weight with Coolsculpting? No, you'll lose a few ounces, but it's not enough to be noticeable on the scale, but you will see it in the mirror. Your clothes will feel better, and you will see the visual changes. What if I gain weight after I do Coolsculpting? Well, you still have a permanent fat layer destruction, so that the leftover fat with one treatment is typically about 80%. So you're still going to have fat that's going to grow, but that area is not going to get as big as it used to. And same as if you lose weight, you still have that 20% reduction, but your native fat tissue is going to shrink, so that the effect of weight loss will be magnified in an area that's been treated with Coolsculpting. So you can do Coolsculpting as many times as you want. Most patients do it 1 or 2 times and get the effect that they're looking for. But we don't make that decision until about 2.5 months. It takes about 3 weeks to see the first changes with Coolsculpting, and about 2.5 months to see the final results. Most people do it 1 time and they're happy. And now we have the Coolsculpting Elite machines, which are the newest offering for Coolsculpting. We have 2 machines allowing us to do 4 areas of simultaneous treatment. The new machines are really nice. We are seeing better and faster results with better treatment effectiveness at the margin. And the results from the Elite are a little bit better than what we got with the last generation, so patients are happier, but the results are coming on a little bit more quickly. So if you have any further questions about Coolsculpting, we'd love to have you set up a free consultation so we can go through all the details and see if it's the right procedure for you. Thank you.